This is a scary one. Bowel cancer cases are rising amongst the under-50s all across the world. Well, Dr Hilary and Dr Amir join me now. Amir, this is very concerning because, you know, we've done a lot of campaigning on this very subject with our lovely Deborah, and this is a worry.
Yeah, it is a worry. So this research shows that bowel cancer rates in young people aged 25 to 49 are going up, particularly in countries like New Zealand, who've seen a 4% increase, and then England, that have seen a 3.6% increase. And it's across both sexes, but it's women more than men. Now, they're not entirely sure why it's happening, but it's likely to be a combination of reasons. So the food we eat plays a big part of that.
Sure.
Ultra-processed foods, red meats, sugary beverages, all are linked to higher rates of bowel cancer. Lower intake of fibre. You know, when it comes to your bowel health, fibre is your best friend. So get plants in there. There's a big push online from wellness experts about carnivore diets, but that's a lot of red meat, and that does increase your risk of bowel cancer. Obesity is a big thing as well, and a sedentary lifestyle. When people are living with obesity, that fat doesn't just sit there. It releases a lot of harmful chemicals like cytokines and growth factors, which damage our cells' DNA, cause mutations which can lead to cancer. And the other big thing, which is a big part of research right now, are pollutants and other things that we might be taking in, like microplastics, and how they affect our health as well. So all of those things might be contributing to this increased risk. Of course, there's the screening for 54 to 74-year-olds in the UK.
It's fantastic. And we know the figures in England. We don't know for the rest of the country. I would imagine they're exactly the same. They're exactly the same. And we're so lucky that we get this test. Nobody particularly likes doing it. No. But, you know, it's over in a flash. There you are. It's done, dusted. Here we are. And Hilary, this is why the No Buts campaign, you know, Deborah's legacy, so important, more important than ever.
Absolutely. So we may be getting a higher proportion of younger people with bowel cancer, but we're detecting it earlier. So the outcomes are likely to be better. So that's the good news. So if we raise awareness, as Dame Deborah did such great work on, if we raise awareness, people know what the early symptoms are, they come to the GP quicker, GP refer them quicker, and we get the diagnosis made and get better outcomes. But it is a worrying trend upwards, and since the early 1990s, the increased rate in younger people with colorectal cancer is 52% higher. So that is very significant.
No, it is. We've got that sticker on our website, obviously, and lots more information on there as well. And again, you know, during this kind of time of year, sometimes you neglect your health. We were talking about checking your breasts earlier. Make sure, as Deborah would say, check your poo.
Check your poo.
That was always what she said, the last thing she said to you. Anytime you were going out, do that. So please do that. Now, look, cold weather, of course, can impact our health, Amir. And which conditions, well, what's especially affected and what can we do?
Yeah, so the first thing, when we breathe cold air in, it can affect your lungs, particularly if you've got an underlying lung condition like asthma. Cold air can be a trigger for the muscle around your airways to squeeze and narrow and cause you to wheeze. The dry air can thicken your mucus as well, and that can trap bugs in there and cause infections. And also, if you're indoors a lot, you're passing bugs around. So all of that can exacerbate asthma symptoms. What I would say to people with asthma, make sure you have an asthma care plan. Contact your practice nurse and get a care plan. Know what to do if your symptoms get worse. Know how to use your inhalers, and check your inhalers today. Make sure they're all in date and working, because if you haven't used them for a while, they may be out of date.
Yeah, no, that's very good. Joints, all that sort of stuff. You know, my funny leg goes funny.
Yeah, well, a lot of people say my joints are always worse in the colder days of winter. And there's a reason for this, because as the barometric pressure drops, the things inside your joints tend to expand. So the lubricating fluid, the synovial fluid, gets thicker, so there's less lubrication. Also, as the joint expands within, so there's pressure on the nerves, so if you've got pre-existing arthritis, it's likely to be worse. So there's reasons. And the muscles, if they don't have a good blood flow, the blood flow is being constricted because the blood vessels are constricting, then it's likely to cause more pain and inflammation as well.
Are you better to go out for a wee walk?
Yes.
You know, just to get you going.
Keep the joints warm and keep them mobilised.
Do some star jumps or something. As if I'm going to do a star jump. But you know what I mean.
You lose it.
I've got you know, the notion is there.
Definitely.
But yeah, I just take my dog out for a walk. That's the best idea, isn't it? Because it's all things like, you know, your circulation is always a bit more difficult.
Yeah, there's a condition called Raynaud's phenomenon, which lots of people may have. It's when you have an exaggerated response to the cold and the tiny blood vessels in your fingers and toes constrict really tight.
Right.
And that can compromise that blood flow. It can cause tingling, pain, blue kind of appearing nails and fingers.
Painful.
It's really painful. So I would say make sure you're wearing gloves and layers, and there is medication that you can get from your GP to help protect you against razors.
Battery-heated gloves as well.
Oh,
and
yes.
socks.
Battery-heated
gloves,
yes.
You say? Yes. From the Raynaud's and Scleroderma Society, you can.
You can.
That's a really good idea, actually. It's all these wee practical things, and they're good presents as well. A lot of people now, this time of year, you've got to make sure that you've got all your medication organised. You know, you're making all these lists about buying presents for people and buying, you know, getting all the food in and trying to be organised, you know, even now. But you've got to make sure all that's in place.
You make sure your regular prescriptions are up to date and you've ordered them in advance. Make sure the pharmacists have got them in stock. Be prepared, because this is a rush time for all those kind of things. But you know, heart attacks are more common this time of year. Blood pressure goes up as your blood vessels constrict. The blood becomes a bit thicker. So it's people out there with their snow shovels exercising in cold air that get the heart attacks.
Oh, geez.
So just
be moderation. I mean, go for a wee walk. That's what we're saying. What's this blue thing you've got here? What's that?
This is a migraine cap. This is like a wearable ice pack. Now, I'm not going to put it on.
Oh, go on.
No. But you put that over your head. It covers your eyes as well. So
it looks like pants.
It does a little bit, yeah. But that's for your nose, not anything else.
Indeed. OK, fine. I'd pay money to see that.
You take this out of the fridge where it's freezing cold.
Right.
You put it over your head and over your eyes. So for some people with migraines, this is quite a relief. So the cold pressure on the skin around the head can relieve the headache of a migraine.
Idea,
but it won't work for everybody, because some people are intolerant to cold and they might trigger their migraine.
I know we've talked about getting cold, but that actually...
Give it a try. There's no clinical evidence that it works, but...
Migraines are
you never know.
horrific.
You never know.
They're horrific, horrible things. And they can completely debilitate you. So anything that's going to help... You know,
it's worth a try.
It's worth a go, isn't it? Amir, what is this walk of Christmas? It's a walk of shame.
Well, it's called the fart walk. It's a viral trend. Instead of sitting down after your big Christmas dinner and watching the TV and going into that food coma, go for a walk. It's good for your health, it's good for your digestion, and it lets the gas out, so nobody's blaming anyone else in that room for that gas. Go for a fart walk.
The poor dog always gets blamed. Angus, for God's sake, what are you doing? Behave yourself. Oh, my gosh. Thank you both so much.
Looking for more health and wellness content? Well, there's plenty more really useful information right here on our channel. How about you check out this one?